Hi, I'm Holly Kappas.
I'm Marin Pelletier.
And I'm Zoe Rasmussen, and we are Team 9. Today, we are going to discuss eye screening technology and how its use can positively impact eyesight in multiple populations. First, we will start off with a few statistics about this topic. According to a research paper about teleophthalmology, diabetic eye disease is the leading cause of blindness in working age US adults, and early detection of this can then lead to early treatment, which reduces the risk of blindness in this population by 95%. Also, according to a different study investigating childhood blindness, it was found that around 70 to 80% of the 19 million visually disabled children in the world are due to a preventable or curable disease if it's detected early enough. These statistics are astounding and really emphasize the importance of prevention among all populations in order to best preserve eyesight, which is what the AI technologies we studied do. Now we will talk about the different types of eye screening technologies and how they are used.
There are new cutting edge technologies coming out to diagnose children with visual impairments that may go undiagnosed for years. TrackAI is one of the technologies that can decrease the number of children with undiagnosed visual impairments. It is an AI powered assessment designed to detect and diagnose early signs of visual impairment in children. This device is very affordable as well as portable, and hopefully, in the future, this device can be used by any person, no matter the level of training they have, to diagnose their child with a visual impairment as young as 6 months old. For example, this can be a mother who is concerned or just wondering about their child's eyesight. She can use Track AI herself to obtain a diagnosis of her child without having to seek out an expensive doctor.
And TrackAI is often paired with DIVE, which stands for Device for an Integral Vision Examination. This is an eye tracking system that creates a map of how a child follows the visual stimuli shown to them through a monitor. It provides automatic, fast, and accurate exploration of the visual function of the patients using it, no matter what their age is. With the heads of the patients held still, it can be determined whether the gaze of the child is within normal range or if it is unusual, potentially indicating a visual complication that is developing. By using the screen, the human error and interference factor is completely eliminated because the screen can detect eye movements, which is more accurate than an observation of a doctor. There are two different versions of this product. One is for ophthalmologists and the other for pediatricians. The importance of the partnership between the TrackAI and Dive is that TrackAI brings eye tracking capabilities of Dive to portable settings, which results in more access and thus able to be more widely utilized by both doctors and patients.
Track AI and Dive will have a major impact on diagnosing infants with visual impairments. Due to the fact that it is extremely difficult to notice that an infant has a visual impairment, this device may be able to save the eyesight or even lives of many infants. To put this into perspective, about 60% of children that go blind due to being undiagnosed will die within 2 years, and 70% of children would have normal eyesight if an early intervention diagnosis took place. With this being said, the development of TrackAI and Dive is beneficial to the future generations and the quality of life these children will have. However, there are some limitations. In order for this type of technology to get approved and put on the market for the general public, it has to be tested on thousands of patients. This may be difficult with infants and children because their parents may not consent to this type of technology being used on their children, so the researchers may have difficulty finding participants. Also, while developing this technology, there needs to be assurance that the results are accurate and people are able to recognize when something is wrong with the infant or child relating to their eyesight. To add more about how beneficial early eye screening is when it comes to improving a child's eyesight and overall quality of life, there was a study done that screened children's eyesight and studied the outcomes they had with treatment. It concluded that the earlier a child gets an eye screening, the better the outcome will be when they receive the treatment for the eye disease they have. Also, this screening detected children who have reduced vision due to refractive errors, which could worsen as a child grows up. Overall, the earlier the eye screening is done, the better the outcome the child will have with their eyesight.
Teleophthalmology is the use of telecommunications devices to remotely conduct eye exams and other ophthalmology diagnoses. With the rise of COVID-19, telemedicine has become an increasingly viable alternative for both patients and doctors. There are many ways to conduct virtual eye exams, including using a mobile app, a website, or a printed version of the regular eye screening chart simply shown over the computer. The accuracy of these remote exams is close to that of traditional exams, with the specificity being about 86% that of a traditional one. These close findings are very indicative of how useful teleophthalmology can be and how viable it is in comparison to traditional exams. These teleophthalmology exams are often cheaper and more convenient for both patients and their doctors. Patients don't have to travel, and doctors don't have to worry about running behind with one patient and going to see another, or having to deal with any of the issues of being late or not being able to physically make an appointment. One 2020 study found that teleconsultation saves travel costs, time, and the efforts of patients whenever in-person consultation is not mandatory. As previously mentioned, these virtual options are often just as accurate as the traditional exams are, so in-person consultation is rarely mandatory. Estimated shortage of about 6,000 ophthalmologists was found by the U.S. Department of Health and Human Services. This shortage is estimated to happen by about the year 2025, which is very close. It's very unlikely that enough ophthalmologists are going to be trained and certified by then. So this teleophthalmology is a great way to bridge that gap between the amount of ophthalmologists we have and the amount of ophthalmologists we need. This way, if these ophthalmologists are not geographically distributed evenly, rural patients can now access their services even if they are not geographically close to their health professional. Our discussion questions are as follows. Number 1, what demographics or communities do you think would benefit the most from this technology and why? Number 2, how do you think shifting towards teleophthalmology will affect health professionals? Will the effects be positive or negative? Here are the works that we cited. We hope you enjoyed our presentation and learned something new about childhood blindness, AI, and teleophthalmology. Thank you so much for watching.